Welcome back to Teeth Talk with the Dental Pro. I'm Dr. Kurt Kaser.
And I'm Dr. Caroline Kaser, and this is Tiffany Benitez.
Hello.
She is one of our dental assistants that's been with us for about 18 years. She does ortho and oral surgery. And today we're going to talk about, you got your braces on. Now what? What do we do? So Tiffany, tell us how do we do things here at Dental Pros? Once you get your braces on, like what is the next steps?
So once you get your braces on, we like to go over oral hygiene, most important, how to take care of your teeth and braces while you have them on. We'll go over how to brush, how to floss, emergency appointments, what to expect with some tenderness, what you can take like ibuprofen, Tylenol, to help with the discomfort. And then we when you have your adjustments, we'll go over the wire changes, what to expect with that. You get to pick fun colors and all that goodness.
Oh, that's cool. What would you say is the biggest complaint? I guess this could go both of you guys. The biggest complaint after someone gets the braces on?
I think Tiffany probably hears them more than I do at the assistant level, so I'll defer to Tiffany.
I say the discomfort with having the brackets, it's all something new with the wires. Sometimes when the teeth are moving, the wire tends to poke in the back, which is normal. The wire only has one way to go, and that's towards the back. Mm-hmm. So if the teeth are moving, straightening out, then sometimes you get those poking wires that we have to take care of. And the discomfort, just everything's a little bit new. You get used to it. I would say within the first couple of appointments, you start getting used to having the braces. Mm-hmm. And then after that, it's pretty easy.
Well, that's good. Mm-hmm. I know that when Grace got her braces on for the first time that we're like, here, just eat this. And it's like, no, they can't just eat that. They need a more of a softer type of diet. Yes. So I found myself making her some oatmeal, cottage cheese.
Cutting things in small pieces,
yes.
Not biting into things.
Yeah, so I think that just be kind of prepared with that with the food for just a couple days. Mm-hmm. And then every wire change I felt with her was not as bad. So the first one I felt like was like the more significant one. It was the most uncomfortable. I ended up not giving her any ibuprofen, but that's always an option, depending on the age of the child, of course. But I don't know. We just kind of changed her diet and went on with that.
Yeah, when you move teeth, that's where the soreness comes in, right? So it's actually inflammation in the body. So I always equate it to if you go for a run or you go work out, or if your child's in PE one day and they're sore the next day, we always say it should never be painful. So if it's painful, please call us, and we just don't get those phone calls. But there will be some soreness, and that's what they're getting used to, right? It's a different feeling. The next day it starts to pick up and they feel it more. Once they know and they've experienced it a couple times, like Tiffany was saying, they tend to get used to it and they kind of know what to expect, a little bit more. The soreness is probably the same. They're just a little bit more used to it as opposed to it being new. With anything, the first couple times you're experiencing it, you're trying to figure it all out and what does it mean, right, as well too. But the soreness is there and people will talk about it, but it's usually very manageable and then it goes away after a couple days.
So you're changing your diet for your kid just a little bit in the first couple days. What would you say about diet going forward? Like, I know that our nephew was in a couple times right after he got his braces on because he would sneak gumballs. He would throw those big, huge gumballs and try to chomp on them in the back. And,
I'm probably not the best one to ask about diet.
Yeah. Not the best one. Okay, Tiffany, do tell us about diet. What are your kids? Your kids are in braces. What are they eating on a regular? What are they actually avoiding? Like, what are we avoiding once the braces are on?
Hard, sticky, chewy stuff is what they need to avoid. So gumballs.
Henry.
Anything that you would normally bite into, like an apple cut up into pieces, chewing on ice, avoid doing that, putting things in your mouth, like biting on pens, anything like that. You want to avoid doing that so that way you don't accidentally pop off a bracket or bend a wire, anything like that. Foods too, kind of the first couple of days, soft foods like your pasta, mashed potatoes, stuff you really don't have to chew often, so that way your teeth kind of get used to them. Then after that, you can have a hamburger, pizza, just avoid the hard crust of the bread.
Yeah.
You don't want to, have a baguette and have to chew, and it's kind of sore on your jaw and on your teeth.
Yeah. So we know now, this is what you eat. Now, how do you take care of teeth once they're, got the braces on? Like, what do you do? What would you recommend in terms of a different type of regimen, or what to do as a parent to help your child, especially the younger ones, be able to clean through those brackets and wires?
I would say try to at least, you're at school, you don't carry your toothbrush. Not everybody does.
I know.
So I would say at least rinse your mouth out, especially if you're in sports and you're drinking Gatorades or stuff with a lot of sugar. You want to make sure that you're rinsing your mouth out at least afterwards, so that way that sugar doesn't stay on your teeth. Brushing in circles, getting all of the plaque, food out of your teeth, flossing. I know flossing is going to be a little bit difficult, but at least floss, at nighttime when you have a little bit more time and you can really get in there and floss. Electric toothbrushes work great. The flossers, super floss, all that good stuff, I would say, is a good investment, especially when you have braces, and especially if you have teenagers that don't really like to brush their teeth. Having those things will help them keep their teeth nice and clean and healthy.
We also have floss threaders. Floss threaders are like this, it almost looks like a needle and thread, where your thread would be the floss, and the needle, it's not sharp. It's very, very flexible, and it's not sharp at all, but it kind of allows you to loop the floss through, and then you can kind of pull that underneath the wire and then floss in between.
Or water picks.
Water
Water
picks.
picks will be a good one too to have.
Yeah, and I think what you were saying, just drinking water too, especially in Tucson, right? Like just drinking water throughout the day is also very cleansing for if you've eaten a meal or you've had a sugary snack, just the water to help flush that out.
Okay, and at Dental Pros, once you come into our program through orthodontics, we have free cleanings for your kiddos and for the adults, 2 additional cleanings on top of your other cleanings with insurance, just to make sure that you are brushing correctly or you're getting that one spot. I know with our daughter, she would just miss like this upper tooth and this tooth. I'm like, you're gonna lose his teeth, like get in there, kid. So it's one of those things where like the kid thinks that they're doing a good job, and usually they are, but they're missing something. Like they're getting on top of the bracket really good, but underneath they're not really doing that well. So I would definitely recommend, if you're not part of our program, to definitely see your dentist and make sure that you're sticking with the hygienist as well throughout the time.
Yeah, and I think that's an important point for us, and we've seen such a huge increase in better hygiene. We have amazing hygienists here that are going to go over that with them, and like Caroline was saying, that's now part of the program, is being able to on top of regular cleanings, even do once every few months, 3 months or so. And it's amazing to have that on staff and to have a specific hygienist that's working with the child on top of the ortho side to work and go over those instructions. And we've gotten amazing results with that, and hygiene's been really good.
Yeah, less inflamed gums, easier to clean the teeth even later, and there's less things that we have to do afterwards.
Yeah, and we have it right here, right in the same office, so there's no extra appointments, you're not going back and forth. We take the wires out, the ortho assistants typically take the wires out for the hygienist. It makes it super easy, you're not making multiple trips, and it's a huge advantage.
You can even get your teeth cleaned while your kid's getting their adjustment, which is great. So anyways, if you have any questions, you always have our number, and this is Teeth Talk with the Dental Pro. Thanks. Bye.